Allie here again with North River Prevention Partners with the second in our series of Community Prevention 101. Tonight we're going to talk about mental health. We're going to cover some things that basic things that everyone needs to know about mental health and mental illness. And then we're going to talk about some things that youth need to know. And then we'll give you some extra resources at the end. I'll start this off by saying I am not a licensed mental health counselor. I am just someone who wants to give you some information. We've got some good tips and tricks here. This is not a substitute for any kind of treatment at all, but it is good information to have. So if you'll stick with us for the next 30 minutes or so, I hope you'll get a little bit out of it. Again, this is our second in a series, and one of the things that I want to make sure that everybody understands is that mental health isn't really any different than physical health. Right now, there's a stigma around mental health, and that's getting better, but it still exists. And the stigma is dangerous because it can prevent people from reaching out for help and speaking out about how they feel. And that's really important to somebody who's trying to get help. And it's really important when you're trying to make yourself feel better that you're able to access those resources. So just like with physical health, everybody has good and bad days. So we all have good and bad mental health days as well. If you might get a cold or a flu and still be considered a very physically healthy person, you might have a headache, you might injure yourself. The same is true for mental health. And sometimes if you get a cold or a flu, you might need medical help to help you feel better. Same with mental health. Even mentally healthy people have bouts of depression and anxiety or stress, and they might even experience a trauma in their life that requires medical help, like the death of a loved one or surviving a natural disaster, that would require the help of a licensed mental health counselor to help get through that. So those are some things that I think is a good to have in mind when we start talking about mental health. Everybody has days where they feel mentally ill or not well. Just like some people have chronic physical conditions like diabetes or autoimmune disorders that can be managed with medication, diet, and exercise. So do some people have chronic mental conditions like depression or anxiety that can also be managed with medication, diet, and exercise. It's important to remember these points, especially in terms of reducing the stigma around mental health and in order to make sure that everybody feels comfortable reaching out and talking about that. We also have to define mental health and mental illness. So you might hear them kind of used interchangeably, and they're really not. It's right there in the name. There's mental health and there's mental illness. You might also hear mental health conditions or mental health disorders or things of that nature. And those, of course, refer to mental illness. But for today's purpose, we're going to refer to mental health and we'll refer to mental illness. So mental health comprises emotional, psychological, and social well-being. It's a state in which a person realizes his or her own abilities, and they can cope with normal everyday stresses. They can work productively and make contributions to the community. Mental illness, on the other hand, is a state that negatively impacts a person's thinking, feelings, or mood, and may interfere with their ability to function emotionally, psychologically, or socially on a daily basis. Mental health is something that we can all do little things to help us maintain when we have it, but it's also important to remember how many people really suffer from mental illness and different types of it. When you talk about young people, a lot of people don't know that our young people can definitely have mental illness. About 17% of young people between the ages of 6 and 17 actually experience mental illness. And about 50% of all mental illness is developed by the age of 14, and 75% of mental illness is developed by the age of 24. So not only can young people have mental illness, but they do have mental illness. In fact, 19% of all adults in the United States experience mental illness, and 1 in 25 experiences a serious mental illness, like a manic depression or anxiety disorders or panic disorders, bipolar, things like that. Anxiety disorders and depression, speaking of those, are actually among the most common mental illnesses for both young people and adults. But let's kill some myths. There are a lot of myths flying around out there about what it is and what it isn't. So one myth is that people with mental illness are violent and unpredictable, and nothing really could be further from the truth. People with mental illness are no more likely to be violent than someone without a mental illness. They are, however, about 10 times more likely to be victims of violence than the general population. Another myth is that it's obvious when someone has a mental illness. And that's not true at all either. In fact, you probably know somebody with a mental illness and you don't even know it. You're not even aware of it. Unless they've told you, you probably wouldn't ever know. Another myth is that people with mental illness can just snap out of it if they try hard enough. One of the things that I've experienced with people in my own family when they're suffering from a depression or something like that is, come on, just do something that makes you feel good, or smile, or think about happy thoughts. And those don't work with somebody who has a mental illness. This is like saying to somebody with a broken leg, they can just dance a jig at any time if they feel like it. They just try hard enough. But the fact is, like people with broken legs, people with mental illness can get better, and many do have a complete recovery with some professional help. So, what are some of the symptoms of mental illness? How do you know if you're someone who suffers with an actual diagnosable illness, or someone who's just having a bad day? Well, feeling sad or withdrawn for more than 2 weeks is a sign. So is seriously trying to harm or to kill yourself and making plans to do so. Severe, out of control, risk taking behaviors that are outside the norm, and sudden, overwhelming fear for no reason. This could present as a panic attack in the grocery store. This could present as, staying wide awake in the middle of the night because of some intense, unnamed fear that you might have. And this actually is pretty common for a lot of people who struggle with anxiety disorders. The other is not eating, throwing up, or taking laxatives to lose weight, or significant weight loss and gain. A lot of people don't understand that disorders such as bulimia or anorexia are mental health disorders, and they often start with something that as simple as turning down a meal or taking a laxative because you're trying to lose a couple of pounds. Those can be significant warning signs of mental illness. Others include seeing, hearing, or believing things that aren't real, repeatedly using alcohol or other drugs to mask and hide your feelings. That's a really significant one. And it's a hard one for a lot of people to differentiate. Um, a lot of times, substance abuse and mental illness coexist in the same person about 30 to 40% of the time, actually. And it's hard to differentiate which one caused the other if one did. But one of the signs is that if you're feeling some sort of way and you're using alcohol or other drugs to mask it, you might want to start thinking about what it is that you're feeling and whether or not it's time to reach out to a professional for help. Drastic mood changes in behavior, personality, or sleeping habits. And this is a tough symptom for a lot of parents to kind of wrap their brains around because teens can be angsty, they can be moody. Part of that is just growing up and it's going through phases. If your child moved on to a new school, a high school or a middle school, it could be any number of social changes that your child's experiencing, but it could also be signs of mental illness. Remember that most of these mental illnesses develop by the time someone's 14, or excuse me, half of them do, and then another quarter of them by the time they're 24. So if this is something that maybe even runs in your family, or that your child's had a traumatic experience, you might want to keep your eye on that and just make sure that you're talking to your child and you guys are communicating back and forth so you can kind of keep your finger on what's going on there. Extreme difficulty in concentrating and staying still. And I have a lot of my adult friends who have this. ADHD is not just the thing for adolescents, a lot of adults have it. And people my age, a lot of us went through our whole lives without it being diagnosed. So if this is something that you're experiencing or have experienced through your life, it's probably a good idea just to talk to somebody about it, just to get an idea, see what's going on. And then, of course, intense worries or fears that actually interfere with your daily life. If you're getting ready for work and you have an overwhelming fear of driving in or making your commute and you call in sick, that's what this is actually talking about. It's getting in the way of your daily activities, of your daily life. If you're canceling plans with friends because you don't want to be out and about, the feeling of being out socially causes you anxiety. This might be something that you need to reach out to help to someone for help for. So we want to cover a little bit about what teens can do. We're hearing an awful lot lately, especially now with kids being a lot of them being at home, going to school, and being socially distanced from friends. And it I know I've seen it in my house, and I know my friends have been talking about it with their kids. It's a lot. This year has been a lot for everybody, and this year has been a lot for our kids. So it's really important that as we come upon the holidays and we start talking about maybe not making those travel plans that we all had to see relatives that are far away, or worried about whether school will start back up in the springtime. These are things, and these are real things that our kids are kind of concerned and worried about. So if you've got a child who is seemingly a little bit distant, things have changed for them, reach out, start talking, start having these conversations. And if you are a teen, there's a lot of things that you can do to make sure the adults in your life are aware of how you're feeling. So it's important to remember that if you're experiencing any of the symptoms of a mental illness, one, it's not your fault. You didn't do anything to cause it. And two, it's critical to reach out to a trusted adult for help, whether that's a parent or a guardian, a teacher, a coach, another family member like an aunt, uncle, or a grandparent, or your guidance counselor. An adult that you trust is a great resource for you. They can help you make the right phone calls. They can help put you in touch with the right professionals to help you get over all of this. So, one of the really great strategies for young people, and this is for anybody, any young person really, who might be experiencing some of these things, or even if you're not and you have friends who are, or you're kind of feeling the pressure, is to make a list of trusted adults in your life, like a contact list, and keep it in your phone. You can label it whatever you want: trusted adults, safe people. Make sure that you have a way to contact those people at a moment's notice. So you can just pick up your phone and hit a button, and you'll be talking to a trusted adult. So you want to make the list of trusted adults that you can contact and ask for help. You want to keep it in your phone for easy access. And always remember that asking for help is the very bravest thing you can do. It's hard, but not every adult understands mental illness or will know what to do. So there's a chance that you might reach out to a trusted adult and he or she may not know how to help you and they may not understand. Don't give up. Just go move on to the next person on your list until you get help, until you find one of those adults who are willing to sit and listen to you and help you find the resources that you need. The other part of this is that sometimes youth don't have a safe adult to talk to. They don't think there's anybody, but there are other ways to access the help that you need. So, one of those ways is locally, we have Centerstone, who is our behavioral health center here in Manatee County. And they address both mental health and substance abuse issues for people across the lifespan. They have an excellent resource page for teens at www.centerstone.org. And they also have a couple of crisis hotlines. And I'll give you these numbers again at the end. And then we'll post them on our Facebook page, and we'll also post them on our website for later. So when anybody needs to have these resources, they'll be available to you. So you can call their crisis line at 1-877 HOPE, HOPE 123, or 941-782-4617. Again, the crisis lines for Centerstone are 1-877 HOPE 123 and 941-782-4617. And we'll post those again for you later. One of the important things for everybody and for anybody of any age is to maintain mental health, not just to look for signs of mental illness, but maintain the mental health that you have and want to grow, if you will. So there are a few tricks to try when you're trying to do that. And especially with the holiday season coming up, I know a lot of you moms out there under pressure to make the perfect meal or to make sure that you're having the most perfect holiday you can in this age of COVID, where more and more of us are maybe stepping back again and taking a break from family and friends in the interest of physical health. And then these are things that you can try though at any time. Anytime life gets a little bit rough and tumble, these tips and tricks should be able to help at least a little bit. Of course, one is to practice deep breathing exercises, stretching, meditating. These are things that you can do when you really just need a break from what's going on around you. You have heard this a lot. I know I have. stand up, take a break, take a 10-minute walk, go up and down the stairs if you're in the office, take a brain break. I know I tell my teens when they're studying, get up, walk around the house, get a snack, get something to drink, take a brain break. And it sounds cliche, but they often work to ground us when we're feeling stressed. If you can just walk away for a minute or two from whatever it is, and then come back and maybe have a fresher pair of eyes, and maybe just give your brain a little bit of a break from that stress. You also always want to maintain healthy diet and exercise. Easier said than done during the holidays. I know, especially when you've got all those delicious pies and cakes and cookies staring you in the face. But there are a lot of different scientific studies that really do tie mental health to our good diet and plenty of exercise. So if that's your thing, you like walking on the treadmill or you like going around the block, those are excellent ways to also maintain your mental health. And you want to avoid using alcohol and other drugs to mask your feelings and get plenty of sleep. That is typically for a teenager. I know this sounds impossible. 7 to 10 hours for a teenager, and of course, 6 to 8 hours for an adult. Um, the other is that when we mask our feelings with drugs or and alcohol, we might miss some really serious signs of something deeper that's going on. And the other part of that is when you do that, once you come down the next morning, you wake up and maybe you have a little bit of a hangover or whatever, whatever was stressing you out before is still there. So you want to make sure that if you're celebrating with family and friends, you're doing so safely, and you're doing so in a way that's not going to set you up later for something that's even worse. And again, the holidays can be stressful for many people, and it can really affect how you're feeling in a normal year. This year, I think that all of us are really kind of feeling the extra um, uh, pressure from the pandemic that's going on. We're being told we can't travel to certain places, that we shouldn't spend time with our loved ones, to make sure that everybody's physically safe. But if you're feeling down, there are ways that you can still be socially distant from those people that you care about and the people that you love. You can reach out with your cell phone. You can talk. We've got all sorts of different apps and things that you can use. You can stay social even if you're not near somebody. You can still stay social during a pandemic. We can find creative, safe ways to spend time. Zoom isn't just for work meetings. You can get free Zoom accounts and have Zoom meetings with your loved ones, with your friends and family. So that could be something that you might look into if that's important to you. And if you're practicing the social distancing, that's probably a really great way to still see your loved ones and send your love to them. Another super easy way to maintain mental health is to make a playlist of all the songs that you love and then the songs that make you feel great. I found that my perfect playlist is about 10 songs long, and I do rotate them out every once in a while. And this works, when you're already feeling great. It works when you're feeling low. You keep it in your phone or on your Spotify account or Pandora or Sirius, wherever it is that you keep your music. And just hit play. And every single song on that list makes you feel fantastic. So that's a really simple, easy way. A lot of you probably already have that. So that's just a real good pick me up. It's a super simple technique, but is very effective. The other part of this is, what if you're not the one in crisis? What if it's somebody that you care about or somebody that you love? What are you supposed to do to help that person? One thing is to remember that you can't fix another person's mental illness, and it's not really up to you to do that. But there are some things that you can look for and ways that you can help someone else reach out for help and get resources. There are some warning signs. So if you think your friend might be depressed, some warning signs would be they don't want to do the things that they used to want to do. You start using alcohol or drugs or hanging out with a bad crowd. Um, they stop doing the activities that they love, especially ones that if you two enjoyed certain things together and uh, they're not participating or they're not obviously enjoying those things. If your friend starts talking bad about themselves, they talk about being ugly or stupid or worthless. And the other is if they start talking about death and suicide. Um, that's a really big warning sign. And that's not something that you should keep to yourself, whether you're an adult or a teen. You should always let somebody else know that this person may be in trouble and that you need help to help them. Something that teens need to remember too is that teens who are experiencing depression tend to rely on their friends more than their parents or other adults. So, your teen may not tell you that he or she is feeling depressed, but their friends may know all about it. Um, if you are a friend of a teen who is depressed and they're sharing that information with you, be sure you're encouraging that person to talk to a trusted adult. Um, and if you're really super worried about your friend, if he or she has been talking about suicide or hurting themselves, you definitely want to reach out, even if you promised not to tell anybody, you definitely want to reach out to a trusted adult and let them know what's going on. It is better to have a friend who's mad at you for talking to somebody than a friend who's harmed themselves or, God forbid, killed themselves because they were having a mental health crisis. So that is not ever a secret that's okay to keep. Um, Talking to your friend that's depressed might seem like a huge responsibility, but there are some things that you can do to try to help, at least in the moment, to help them feel better. You can say simple things like, "You seem down. Is there anything you need to talk about?" Or, "You're not yourself these days. What's going on? You can talk to me." Um, and then you want to listen carefully without judging them, and probably not without giving them too much advice either, unless, of course, they ask for it. But surprisingly, just having someone to bounce ideas off of, to just listen to what you're saying, is a really great way to be a friend and to make sure that your friend knows there's somebody out there and they can get some help. Other things include inviting your friend to come hang out, go to the movies, take a walk, do those kinds of just friend things, you know? Encourage your friend to reach out to a trusted adult. I cannot stress this enough. If you are a young person and you have a friend who is going through something, it's really, really important that you encourage them to reach out to a trusted adult for help. You can offer to go with them, you can offer to be there for support and all that good stuff. But these types of issues aren't meant for you to carry. They can get very, very heavy. And so if you can reach out to an adult, get someone on your side who can provide more resources for you and your friend, especially, I think that that is absolutely the best way to go about helping your friend. You never want to ignore, again, comments about self harm or suicide. And even if you're not sure, tell somebody, tell a trusted adult. Even if you promised not to, please tell somebody immediately. The other thing to remember is to always, 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 always be kind. Be kind to yourself. Remember to give yourself a break. Remember that nobody is perfect. Mistakes get made. It's okay to be a couple of minutes late for a meeting. It's okay to be a couple minutes late for school. If you need that time to pull yourself together, to decompress, to make yourself feel better, just be kind to yourself. Treat yourself with gentleness. And you want to be kind to other people too. You just don't know what somebody else's situation is. Everybody deserves kindness. Everybody deserves respect. So whenever you have an opportunity to be kind, remember always to be kind. Now, one of the things, and of course, we don't offer help at North River Prevention Partners for mental illness. We offer information. So, one of those things is that we want you to know about the resources that are available to you. And like I said, we will put these resources up on our Facebook page after the broadcast, and we'll also put them up on our website. It's important to know locally where to go for help. Right now, our community partners at Centerstone they have phenomenal counselors there ready to help anybody of any age. They can help children, teens, adults, seniors. They can help anyone with a mental health issue, and they also have a couple of crisis lines. So if you just want some information about the different services that Centerstone offers, you can find out at Centerstone CENTERSTONE.org. And that'll take you to their website. It's a great website, lots of different tips, tricks, resources. They have lots of links to different other areas that they provide resources for families and for all sorts of things. But if you're in a crisis and you need to talk to somebody right now or get connected with a counselor immediately, you can call their crisis line They have two of them. It like before, it's 941-782-4617, and the other is 1-877 HOPE 123. 1-877 HOPE 123. And the Centerstone is local to Manatee County. Now, nationally, there are a number of resources available to you. NAMI, the National Alliance on Mental Illness, has an excellent website with all sorts of information and resources, and that's NAMI, NAMI.org. Of course, there's always, if you are feeling like you want to hurt yourself or that life isn't worth living anymore, or you know somebody who is feeling like that, you can reach out to the National Suicide Prevention Lifeline at 1-800-273-8255. It's 1-800-273-8255. And then another resource that I found recently, and this is something that I am so glad exists. I didn't know they existed. It's called the Trevor Project, and the Trevor Project is for youth who are LGBTQ. So gay, lesbian, trans, and questioning youth can go to the Trevor Project at thetrevorproject.org, and there's lots of resources. Youth who are LGBTQ are at higher risk for mental illness. They're also at higher risk for drug and alcohol abuse. And they also report that they feel like they have less resources than youth who are not LGBTQ. So again, you can go to the trevorproject.org for lots of different resources, but also they have the Trevor Lifeline. And that is a crisis line, and you can reach them at 1-866-488-7386. That's the Trevor Lifeline, TREVEVOR, sorry, Lifeline, 1-866-488-7386. And again, we'll have those up for you at the end of the broadcast. I want to wish everybody a happy Thanksgiving, and I hope you get to spend the holiday the way that you'd like to spend the holiday. You see your loved ones in some way, shape, or form. And take care and look for these resources on our website and as well on our Facebook page. That's NorthRiverPreventionPartners.org, and right here on our Facebook page. You guys have a great holiday. We'll see you next month when we talk about teen drinking and parent social hosting. Talk to you again soon. Bye-bye.